Welcome back to Aesthetics Magazine. Find more skincare resources at aestheticsmagazine.com. In today's episode, we will be discussing body treatments, exfoliation, and body scrubbing techniques. In regards to the exfoliation and the scrub treatment, primarily the exfoliation is the process of removing the dead skin cells from the epidermis. When the natural skin renewal process slows down, the dead skin cells can build up on the skin, leading to a dry, rough, and dull appearance. In addition, the buildup of dead skin cells can block hair follicles and pores, leading to blackheads and acne. By exfoliating the skin, it helps to unclog pores, refresh the skin's appearance, and allow moisturizers and other products to penetrate more effectively. Exfoliation should usually be done after the client has been cleansed and is laying down on the treatment table. This is because oils, sweat, and makeup can form a barrier on the skin, preventing the effective removal of the dead skin cells. Also, it is important to use the correct type of exfoliant product according to the client's skin type. For example, treatment exfoliants may contain hydroxy acids or enzymes for deeper penetration and more intensive results. Chemical exfoliants such as hydroxy acids act by dissolving the intercellular glue holding the cells together. Some hydroxy acids are known as keratolytic agents, meaning that they are able to break up or dissolve the outer layer of the skin cells and remove the dead surface layers, resulting in the regeneration of new and fresher skin. This is useful in treating sun-damaged skin as well as acne. By comparison, physical exfoliants contain small grains or a gritty substance, which is used to mechanically abrade and remove the dead cells from the skin surface. Although in general, hydroxy acids provide a more effective way of removing the dead skin layer and in maintaining a cleaner skin, an advantage of using products containing hydroxy acids and enzymes for the exfoliation treatment is that they are less likely to cause traumas to the skin. This is because these treatments do not require rubbing and scrubbing so hard on the skin to achieve the exfoliation benefits, preventing irritation and sensitization to the skin. On the other hand, if the process of a hydroxy acid exfoliation is not performed properly, it can lead to some adverse effects such as erythema and desquamation. Also, it is important to keep in mind that skin sensitivity to the sun will be increased, and photosensitivity is one of the side effects. So high-level UVA and UVB sun protection should be applied after the exfoliation treatment. On top of that, the ability for the skin to renew itself may decrease as the natural skin process has been altered, and this effect on the skin is similar to chronic sun exposure. By following the manufacturer's instructions and guidelines for the exfoliant products and performing a professional body scrub treatment, estheticians are able to minimize the potential risks and achieve the maximum benefit of the treatment. For instance, wearing professional uniform and recommended gloves, using all the resources, including sponges or towels provided correctly, and providing clear instructions and professional advice to the clients. Body wrap and mask application techniques. When selecting a facial mask, select one that will best benefit the client's skin type and condition. Masks and body mask products are applied in thick layers with various different types of application methods. For example, more solid, clay-based masks are often applied with a wooden spatula, while softer, cream-type masks are applied with the fingertips. Brushes can be used to give a painterly or more artistic effect, or to ensure an even application. For body treatment services, mask products are usually applied with a gloved hand to the larger areas of the body, while a small facial brush or fan brush can be used to apply the mask to smaller, more detailed areas of the body. Always remember to protect the client's eyes with either eye pads or a pair of cotton pads when applying any type of mask to the face. Likewise, when applying a facial mask, avoid the area of the lips and the openings of the nostrils to prevent any of the product from being ingested or inhaled. Apply the mask to the forehead, cheeks, and chin first, and then complete the application on the neck and throat. When applying eye pads or cotton, lightly moisten with water or toner and a cotton pad before placing on the eyes, and make sure to leave the nostril area open to prevent the inhaling of any product. Once the client has been covered with the chosen body mask product, additional insulation is needed to keep the client warm. A thermal blanket is a common tool used for this purpose. It consists of a blanket made of heat-retaining fabric with an electric heating element built in. The blanket is spread out on the treatment bed, and the client lays down on top of it. The technician then covers the client with the blanket, adjusts the temperature according to the client's comfort, and finally covers the client with a warm sheet and blanket. The thermal blanket is left on for about 15 to 20 minutes, the same length of time most body mask treatment protocols last, and then shut off before the client is unwrapped and taken off the treatment bed. Guidelines for body treatments. First and foremost, it is important to observe proper draping techniques to ensure the privacy, comfort, and warmth of the client. Proper draping also ensures that only the area of the body being worked on is exposed. Throughout the body treatment, the client's body should always be covered by draping, with only the area being treated at that moment exposed. Always instruct the client on how to disrobe and prepare for the body treatment in private. Provide a well-ventilated area, separate from the treatment room, where the client may undress and remove jewelry and other belongings. Prepare the treatment area and ensure that it is neat and organized before bringing the client into the room. Avoid clutter and maintain a clean and orderly workspace. Items such as oils, lotions, and linens that may be needed during the treatment should be within convenient reach, and unnecessary items should be cleared from the work area. Time management is essential to the success of a body treatment. It is important to keep the treatment within the time frame scheduled, and at the same time ensure that it is done properly. The esthetician should have good organizational and scheduling skills in order to accomplish this goal. A client's appointment should not be interrupted or delayed because of poor management of the esthetician's schedule. In addition, full sessions of body treatments should be scheduled in a way as to allow sufficient time to perform the treatment and minimize stress and scheduling conflicts. To complete a body treatment well, the esthetician should allow sufficient time for the treatment and to communicate with the client on issues such as medical conditions and personal preferences. After the body treatment is completed, it is important that the client is attended to. Always offer help to get the client off the bed, especially if the client is an elderly individual or someone who has special considerations. Always offer the client some water or other liquid, as it helps to flush out toxins that may have been released during the treatment. Also, it is a great way to help the client slowly regain awareness of their surroundings. In addition, the esthetician may wish to discuss with the client the performance of the treatment and the client's experience. The client should be given professional advice on aftercare and any recommendations for subsequent treatments. The client should feel that his or her feedback and opinions are valued as ergonomically and comfortably as possible. It's time to level up your skincare product expertise. Are you confident explaining vitamins A, C, and E to your clients? Stop guessing! Get the Essential Guide by Greg Risha, Understanding Vitamins in Skincare. Get your copy today at aestheticsmagazine.com.